Thank you for joining us. The following presentation is from a webinar titled The Patient Protection and Affordable Care Act, originally produced on September 26, 2013. The presenters are Suzanne Sentman with McKonly Asbury and Keith Evans with Willis of Delaware. Enjoy the presentation and visit us online at www.macpas.com for more information about future events and upcoming webinars.
Good afternoon, everyone. One of our goals here at McKonly Asbury is to provide our clients with the most accurate, up-to-date information as possible. One of the topics, a contentious topic, I think everyone would agree right now, is that of healthcare reform, or Obamacare, as it's being called. With us today, I'm very pleased to say we have Kent Evans with us. He was our guest speaker who presented earlier with us back in June. It provided us with a healthcare reform update. Kent Evans is the Vice President and Human Capital Consultant with Willis of Delaware. To tell you a little bit about Kent, he is a graduate of Kutztown University with a Bachelor of Science in Economics and a Bachelor of Science in Finance. Beginning his career with John Hancock Financial Services, he has been a licensed insurance representative for over 20 years and has worked as a licensed agent, team leader, managing representative, and was co-principal of an agency. Today, he is Vice President and Practice Leader of the Human Capital Practice for Willis of Delaware, Incorporated in Wilmington, Delaware. Kent has a passion for healthcare and has been involved in the national political debate over universal healthcare and has served on a federal universal healthcare committee with former President George H.W. Bush and on the Medical Society of Delaware Universal Healthcare Task Force as a technical specialist. He served on the National Association of Health Underwriters Broker Advisory Council to Washington, D.C. He has also been invited to speak at numerous state and local healthcare reform events and television and radio stations regarding the Patient Protection and Affordable Care Act, or as we say, PPACA. So welcome, Kent.
Well, thank you, Suzanne. We're very honored to be here today, and we appreciate the time and working with McKonly and Asbury and also their clients and bringing you this new news and additional information. And Suzanne, again, thank you very much. It's a pleasure to be here today and also talking with you folks regarding this contentious piece of legislation that is out there. My lawyers would not be happy with me if I didn't start off with a disclosure, so please bear with me as we talk about this information today. This is to be for informational purposes only, so humor is humorous, and this is not to be taken as legal advice, but if you do have any follow-up questions, feel free to ask your representatives here at McKonly and Asbury, and they would be more than happy to answer your questions and also direct you if they have any questions that they want to pass on to me as well. So please feel free to do that. So let's dig right in. We have a lot of things to cover today. If you're listening in today and you're a little ashamed because maybe this is the first time that you heard about this piece of legislation called the Patient Protection and Affordable Care Act and you're a little bit confused, please, you're not alone. Most of the Americans that are out there, believe it or not, there was a Kaiser study done in the spring of this year. About 40% of us as U.S. citizens that are out there believe that the Affordable Care Act is no longer law. Of that number, 12% believed Congress has already appealed it, and 7% of that number believe the Supreme Court has overturned it. So if you're confused with this information as you tune in today, don't be afraid. Most citizens that stand along next to you at the McDonald's or the coffee shop in the morning, they're in the same position that you are.
And could I just say one thing, Kent, as far as any questions that folks have throughout the presentation, we will do our best to answer those, or we will save them toward the end, depending on how many questions we have throughout.
Terrific. So our objectives today are really very high level, and we're going to be talking about the health insurance exchanges and what is coming. We are less than a week away, and here they come. Information for the exchanges for many states and for the federal were released last week. So for those of you who have not received that information, it is out there. Health and Human Services website and a lot of state insurance department websites have this information, including the Pennsylvania Insurance Department. We're going to talk about who's available to be able to be part of the exchanges. What does that mean? What what's their eligibility, the enrollment process. We're going to talk about the income and these wonderful things we keep hearing about called tax subsidies, and the cost sharing reductions and how does that impact you and I. And then a little bit about this employer mandate that's been delayed and how does that impact us, and also how does it impact us as U.S. citizens. So what is an exchange? Well, if you have not had the chance to sit down and read the Affordable Care Act and all the thousands of pages that have to deal with this, I have had the opportunity to spend a lot of time in Washington with our elected officials. Yes, I know you're all applauding, but in doing that, in meeting in the halls of Washington, in talking to these elected officials and having them really explain to you and I, as their constituents, what is an exchange, they turn around and they explain it as such. You'll notice that the Expedia logo is on there. No, we don't get any extra money by putting the Expedia logo on there. But they describe the exchange as an Expedia, an Amazon, the Google. It is the new way of going to be buying insurance. This is our elected officials, and that's how they're explaining it. The intent behind the legislation is that these exchanges would be an electronic technological platform that will allow the average citizen with at least an 8th grade reading level to be able to buy insurance, to do an apples-to-apples comparison, unbiased approach, easy to read, easy to understand, so I can go online and be able to purchase these insurance products. From the employer's perspective, what is going to happen for all size employers, and especially the small employer? And please don't forget, the definition of small employer is changing across North America. Across the United States, the new definition of small employer by the federal standards is under 100. Many states, if they have a different definition, they'll be able to utilize that for the first 24 months in the exchanges. But really, the federal government is deciding that the line will be at 100. You will be a small employer under 100 for the exchange and over 100. If you were a small employer in the past and wanted to do something that's called a defined contribution, in the past, maybe, you know, when you met your insurance professionals and you gave them hugs at renewal time and had all those wonderful discussions. Now, for the first time, instead of talking about a percentage of premium or what plan do I offer, you will now be able to talk about a defined contribution and allow your employees to have a dollar figure and then go out to these technological platforms and buy a plan which is best suited for them. You get away from trying to make a decision on picking 1 or 2 plans as an employer. You know, what's best for my 22-year-old Susie versus Brenda, who is 41, a single mom with 2 kids. That's always been a struggle for employers. Now they're going to be able to offer more plans and give a dollar figure and then be able to have that employee make the best decision for them. Some compliance information. This notice was to be handed out on March 1st. It was delayed. We are right around the corner. If you have not handed out the Department of Labor exchange notice, it is due by October 1. You must hand out this notice if you want to know where it is, if you have not received it already from your insurance professional or from your attorneys or your CPAs. You can go on the Health and Human Services website. It is also available on the Department of Labor website, either one. There are 2 notices. Confusion that is out there is one notice is if you offer insurance, one is if you don't. It's a very high-level question. You, the employer, ask yourself, do I offer insurance, period, or question mark? That is the question that you ask. If you do, then you hand out one notice to all your W-2 employees, whether they're full-time or part-time or not, whether they're eligible for your health plan or not. Do I offer insurance? They get one notice. If you're an employer who doesn't offer insurance at all, then there's a second notice that gets handed out. Basically, Washington is asking the employer to be the Postal Service, get this information out to everybody by October 1st. We've also read in the last week from the Department of Labor, well, if I don't do it, is there a fine? The easy answer is no, there's not. However, the regulations say that you are supposed to hand them out. There are some other additional guidelines on what size employer you're supposed to be and other little nuances. You can check with your CPA on that, check with McKonly and Asbury, and they'd be more than happy to walk you through on what defines an employer, but please get those notices out. The way we buy health insurance as an employer and as individuals in the United States is going to change. Right now, if we buy health insurance, we buy it through what is called the general marketplace. That's going to change now because there's really going to be 3 main distribution channels. You will still have on the one side, you will have the general marketplace, which exists today. Then you will have these new things called public exchanges. Currently, there will be 2. One will be the shop exchange. We'll talk in a few minutes about what that is, and that's available to the employer. And this other one is called what is going to be called the individual marketplace. It was originally called the individual exchange, but exchange does not translate well in Spanish, we all found out, so they had to change the name to individual marketplace. So that will be for individuals who their employer doesn't offer insurance, and for individuals that will need assistance through things like are you available for Medicaid, for CHIP programs, because at the end of the day, the intent behind the law was to make this a decision tree. I'm to go on the individual marketplace if my employer doesn't offer me insurance, and it will ask me questions. Fill in the information, look at my last 2 years of income, and it will tell me, Kent, by the way, did you know that you could get into Medicaid? Washington believes there's about 11 million of us out there who aren't aware that we can get into Medicaid.
Interesting.
So the roles are going to change. So that will allow us to be able to get into Medicaid. That will be the first question. The next one will be, hey, Kent, are you aware that your children are available for CHIP? Would get them enrolled. Then it will go through the tax subsidy and the cost reduction sharing. We'll talk about that a little bit later. And then if none of those criteria match, then it will just say, okay, here's the marketplace. Which type of plans would you like? And please feel free to go on and select and click here and click here and click here. In the middle will be these things called private exchanges. And I get the question all the time, well, this is confusing. I got the public on one side, the commercial, now these private exchanges, why so complicated? Please remember in the beginning through the public exchanges in the very beginning, especially in January 1st, 2014, the public exchanges will only offer medical and dental. In addition to that, we hear about all these things called metallic levels, bronze, silver, gold, and platinum. What happens if you currently have a plan that is silver plus, platinum minus? It doesn't quite fit. How is an insurance carrier going to market that plan? They're going to offer it through the private exchange. In addition to that, the private exchanges will be available for all employer sizes. In the beginning, the shop exchange will only be available for small employers. So if I'm a large employer, what can I do? You can offer a private exchange. Last but not least, what happens if you want to offer vision insurance, life insurance, dental insurance, plus pet insurance, all through a defined contribution? You can do that through the private exchange, where currently it's medical and dental only through the public. That's why all three distributions will change. The law does say that if it's offered through any distribution method, the price must be the same by law. So if it's the same plan through any distribution method, the price will have to be the same. In addition to that, the pooling that supports any of those distribution channels must be the same. So one carrier now, one pool, one state. Used to be you could go through this chamber, it'd be one price, go direct, it was another price, go through the Farm Bureau, it was another price. That's because all the pools were different. Now, if the product is the same, it has to be the same price. But if it's different, don't forget, different products can be different prices. So we will see competition there. But the underlying pools for small business will change because it'll be one pool. Theoretically, that should be a good thing for us.
And again, small would be those employers under 100.
Federal definition is of under 100. If the state has a different definition, it can change. I'll use the example of Delaware. Delaware has a different definition of small employers. So for the first 24 months, it'll be 1 to 50. Many states call an employer 2 or larger, but Delaware, we're different. And so we called it 1 to 50. And then after 24 months, it will go up to 100. And then after 2017, it will be available for all employers, all sizes. So let's talk about these public exchanges. We mentioned briefly the individual marketplace. That'll be available for those who do not have coverage offered to their employer or who are looking for a CHIP program or a Medicaid program. And then the shop exchange will be available for the small business in the beginning. The shop exchange, Small Business Health Options Program, SHOP for short. This will begin on January 1st, 2014. All the exchanges will be up and running, we're told, in each state across the United States on October 1st to accept business. This is going to be to accept business beginning on October 1st, but not to begin until January 1st. So most of these are supposed to be up and running. Also, in addition to that, please make sure that you work with McKonly and Asbury here to make sure that if you're an employer, a small employer, under 25 employees, you may be eligible for those tax credits, and you want to work with your CPA here to make sure that you get the most maximization, because if you're paying at least 50% of an individual premium for your employees and you are 25 or less, and there's also an income range that needs to be met, but if you meet those criteria as an employer, you might be able to get a tax credit right now to help pay for your offering of health insurance for your small business. All right, small employers federally, 100 or less. Again, certain states like Delaware and some other states in the union will offer that up to 50 for the first 2 years. Then after that, it'll change. Most sole proprietors, because most states like Pennsylvania, the shop exchange starts at 2. If you're a sole proprietor, you will be buying your insurance through the individual marketplace rather than through the shop exchange. Please also remember that the definition of full-time employee is changing. Full-time employee is 30+ hours. Our organized labor friends, as we read about in the newspaper, are not happy about this. There's been a lot of letters written to Washington about this being one of 2 or 3 things that they're unhappy about and wanting to change that definition. But as of right now, the way it stands, effective January 1st, a full-time employee is 30+ hours. Let's talk about the individual marketplace and what this means in the enrollment. For individuals and families through the individual marketplace, open enrollment, we talked about this, begins on October 1st. It will run through March 31st the first year. So it will begin on October 1st and it will run through March 31st. But that will only be for the first year. Then after that, it will change and it will match what we all know as the Medicare open enrollment. It will run from October to December after that. So they will match up exactly at that period of time. Why an open enrollment? There is some belief that there would be some citizens out there that would try to game the system. Not that any U.S. citizen would ever try to game any system, but the fear is that if they don't do this, then individuals will wait, pay penalties and fines, wait till they get hurt or sick, and then buy insurance. So the intention behind this is to create an open enrollment cycle longer in the beginning to get everybody in because of all the communication that needs to happen. And then after that, we're going to move it to the Medicare enrollment time. How the individual marketplace works, it will be basically, think of it as an electronic supermarket. You're going to go online, it will ask you those decision tree questions. Are you available for Medicaid? Are you available for CHIP? We'll get you in those first. And then we'll ask you about tax subsidies and cost sharing. But at the end of the day, here's some medical plans, here's some carriers. What would you like? I'm going to buy the bread, the milk, the butter, and I will pick off of a menu, kind of like going grocery shopping. And then after that, I'll click please enroll, and it will automatically enroll me. Please remember, in insurance effective January 1st, guaranteed issue, no pre-existing health conditions. Originally, the application of this was about 26 pages long. Now, I never got to see the original application, which was probably a good thing, because the first thing that would go through my mind is, if you're not asking me any medical questions, why is the application 26 pages long? But now it will be somewhere between about 4 to 6 is what we're told. It'll ask you basically rank and file questions, and then from there you'll be able to take that information and use that when you go online to enroll. One process to determine the eligibility, again, the intention behind this is to make it easy and simple. Decision tree. Please plug in your financial information in the beginning. I'm sure we all heard and read about this in July, because one of the things that came out over the July 4th weekend is that the IRS verification about income was not going to be electronically set up by October 1st. On Monday, after the Republicans attacked that, it did come out from the IRS that the IRS did say on Monday that they would be verifying the income, but it would be done after the fact through paper. So yes, it will be an honor system in the beginning, and we will plug in our information. From there, it will tell us what our eligibility is under Medicaid and then also under the tax subsidies as well. Then from there, it'll go through, figure out my CHIP, then figure out my cost sharing, and then figure out my tax subsidies. A qualified health plan. Any insurance carrier that is allowed to offer insurance through any of these exchanges has to be a qualified health plan. Qualified health plan means that you have to offer at least the essential health benefits. We'll show you what that is in a little bit. You must offer at least a plan at the silver and gold level to begin with, not just the bronze level plan. You have to be an insurance carrier that is licensed in that state and in good standing, and you have to agree, as the law says, that if you offer the same plan in different distribution channels, it has to be the same price as well. Yes, the Affordable Care Act does in time allow for cross-state line competition, but because so much had to be done so quickly and so rapidly for this to happen, It was originally aligned, at least for this upcoming open enrollment cycle, that each state insurance department would regulate the insurance carriers in those states. So right now, can we buy Blue Cross of Indiana? No, that's not available in Pennsylvania right now. In time, we may see that change. The law allows for it. But right now, in the beginning, for regulations and to make sure there was going to be no fraud and the right insurance carriers were offering the right product in the right states, it's being regulated that for every state that's licensed in that state, that's the one that will be offering in that state. The essential health benefits. We mentioned that before. We're not going to read through all of these, but I would like you to look at the bottom right. This is new. For all of us who have health plans. Most of our health plans in the past did not cover pediatric services, including oral and vision care. That's going to be something new. But any plan that offers any health insurer that offers a plan through the exchange, the plans must at least offer these minimal essential health benefits. So it's very specifically 10 health categories written by Washington to make sure there are certain coverage options. Plan levels of coverage. These are these metallic levels we talked about, bronze, silver, gold, and platinum. Think of it as a 60% coverage, 70, 80, and 90%. From a very simplistic point of view, but please be careful, but I'm going to try to explain it this way. Yes, if you have a $1,000 MRI done, if you have a bronze plan, it should cover about 600 of it. If you have a platinum, it should cover about 900 of it. But that's too simplistic. It really is an actuarial formula that on the average cost of care for an average person over a 12-month period, it should cover about 60%, 70%, 80%, 90% of those benefits. It's not a per line item. So if you buy a platinum plan and it doesn't cover 90% of a certain drug, don't think that they've necessarily made a mistake. It would be the overall cost assumed over the course of that year. It is an actuarial formula. These private exchanges, we had talked about the private exchanges. Many of them are being developed by companies like the Googles and Amazons, and there's companies out there called Liaison and some Bloom, and there's many, many others. Currently now there's about 117 of them across the United States. We expect that number to grow in the beginning, and then in time probably we'll see acquisitions and mergers and some shrinkage. But in the beginning, many of these public exchanges will be partnering with insurance carriers and associations and brokers and consultants and other different employers and school districts to be able to bring together all the different resources that are out there so a larger employer can offer a defined contribution and have a easy, intuitive technological platform for people to go on and buy. Many employers are asking, well, I already offer an enrollment system, I already offer a wellness program, those type of things. Do I really need an exchange? And that's a good question. You may or may not. You really should analyze if an exchange is the right thing for you. I'll give you an example. Willis, we have about 25,000 employees and we currently use PeopleSoft. It's a very plain vanilla enrollment system. When you go on, it basically says, Ken, here's your medical plan, here's the money that Willis gives you, and would you like to enroll in A or B, and here's your dental and your life insurance and those types of things. Very plain vanilla. There's no videos on there that explain to me what an HSA is. It's not intuitive. It doesn't ask me about my family and say, hey, let me ask you about how often you go to the doctors. Do your kids fall down a lot? Do you know what an HSA is? Do you feel comfortable with that type of risk? Some of the new technological platforms in these exchanges will allow those individuals and those employees to be able to have a better user experience because it will ask you those questions, give you that information. Many of them have avatars. Some of them talk multiple languages. So it really becomes a consultative approach with your insurance professionals to make the decision, is this best for me? Eligibility enrollment. For the marketplace, if you have to live in the service area, please remember again in the beginning it will be state specific, so you have to live in the state, have to be a U.S. citizen or have the documentation to be in here. My favorite one's the last one because not to be incarcerated, because if you are, you already get free health insurance and you get free, and if you look good in orange, you get a free jumpsuit. But at the end of the day, you have to make sure that you are a U.S. citizen and live in the service area to be able to purchase those products.
I have a question for you, Ken.
Mm-hmm.
As far as the resources for folks to enroll, you mentioned before about going online. For those 40 million or so uninsured folks that are out there right now today, will they be able to actually pick up the phone and talk to someone to help guide them through this process?
It's a very good question. There are these people that we keep hearing about called navigators. And there's also, in addition to that, there's going to be these counselors. There has been a lot of grant money offered because of the vast amount of people that are going to want to, who maybe don't have insurance right now, are going to want to get into the exchange, or maybe who want to get into Medicaid, or are in low income, living in low income areas, or maybe have a language barrier. These navigators and counselors will be trained to be able to help and assist those people. Now, they will not be licensed professionals. They're not allowed to give advice. So if you ask them, what do you think's best for me? You know, what's the difference between this health plan and this one? Is my doctor in this network? Technically, the technical answer is they're not supposed to answer those. They are there to help you that if you come in, and they'll be positioned to places like Walgreens and CVS's and certain libraries and some medical units, some non-profit organizations will have these individuals, and they will be assisting folks to be able to say, okay, let's go over to the computer, let me help you, click here, compare this, decide what you want. Here's how you fill out this information. Oh, by the way, here's what this tax subsidy is and what that means to you, and please click enroll. And then they will get a transactional fee to be able to help those individuals do that. In time, we believe that will die down, one, because there was grants funded for this that will probably dry up. And after so many of these 40 to 50 million Americans, Suzanne, as you said, they'll be able to, we won't need all that assistance and that help. But in the beginning, it's all hands on deck.
Right. Okay. Thank you.
Mm-hmm. We talked about what the initial enrollment period is from that October 1st to the March 31st. Also be aware that after that, when you're looking through that enrollment period, if you enroll before December 15th, it will begin on January 1st. After that, if you enroll on January 3rd, let's say as an example, it will become available on February 1. If I'm a little hesitant and I wait till January 17th, it's not going to be, my enrollment will not be until the 1st of the following month or March 1st. Now, no confusion there, but the average citizen hopefully understands this, and the navigators and insurance professionals will walk people through this to let them know that depending on the day that they enroll, it could be the 1st of the following month, or it could be as much as 1st of the extending of the following month, so it could be delayed. There are special enrollment periods. Think of this as kind of qualifying events. If you currently have a COBRA situation, or you offer an employer plan, somebody gets married or divorced, or you have a new child or something like that, these special enrollment periods will allow you to be able to go off cycle. So if your employer cancels their plan, or you're on a spouse plan and your spouse loses their coverage, that type of thing, it will be very similar to the special circumstances in the past to be able to get on a health plan. It will be very similar, so it'll open up that open enrollment time. Marketplace affordability. This we wanted to talk about, again, what these new tax credits are. Tax credits are really for that small employer less than 25. Then after that, there's going to be monies available in these tax subsidies and these cost sharing reductions to help offset some of the premiums. Let's start with the tax subsidy. The tax subsidy will be premium assistance. The premium assistance will be available to individuals who make up to 400% of the federal poverty level. The intent behind this will only be available through the public exchange, the individual marketplace. It is not available if my employer offers me a quality and an affordable plan. So if my employer offers me a quality and an affordable plan, the tax subsidy and the cost sharing is not available to me. But if they don't, or if I'm part-time, or I work for an employer who doesn't offer health insurance, I can go to the individual marketplace. It will ask me questions, and then from there, up to 400% of the federal poverty level, I will get a money from the government, and what will happen is I will pay my portion of the premium, and Washington will pay, or the state will pay the other portion of the premium.
Definition of a quality plan.
Good question. What's the definition of a quality plan? We'll mention that we'll talk about that in a few minutes, but the easy answer for that is if, as an employer, you are offering at least a bronze level plan. So, for example, if you're going to now offer through one of the exchanges, and maybe you're going to offer a package and there's 3 to 5 plans available, if one of them is at least a bronze level plan, then you are offering a quality plan. That's not going to be hard to meet. The affordability is a little trickier, and we'll talk about that in a little bit, but quality will not be as hard to meet. But you can see by the chart, a family of 4 can make up to $92,200, and they're going to get some type of tax subsidy. Now, it is a sliding scale, so the higher you make towards that maximum, the less that you will get. And if you want to have some fun, you can wait those 5 or 6 days and test it next week. But if you are really excited and you don't want to wait, go on the Kaiser Family Foundation website, bottom right-hand corner. There is a spot where you can run tax subsidies calculation, pretend you're somebody else, have fun with it, and run it, and you can see what all the different tax subsidies will be. Up to 400%, the example we used is the family of 4, up to 94.2 in 2013. It will be based on a sliding scale, and this will continue, and it will be paid in a 2-payment system. It will be paid to the insurance carrier for the government's portion, and I, the insured, will pay my portion as well. In the beginning, this will not be verified electronically, as we mentioned before. It will be an honor system in the beginning, but the IRS does tell us that they will come back after the fact to do the verifications. Here is something that's not talked about a lot on CNN or Fox News or wherever you get your information, is the cost sharing reduction. If I am an individual or have a family who is under 250% of the federal poverty level, I'm going to win twice. Not only am I going to get the tax subsidy for me and my family to help offset my premiums, but I can also get a cost sharing reduction, which means that the government will also help pay part of my deductibles and coinsurance on my medical plan. So if I am under 250%, I will get not only the tax subsidy for the premiums, but then the government will also help pay my deductibles and coinsurance on whatever medical plan I select. There are catastrophic plans available. That's a question that we receive a lot. These are available, but they are limited. They are only available to individuals under the age of 30. So it has to be someone who is under the age of 30, and these are special plans that will be available on the exchanges. They will be very high deductible, lower premiums. They will have some very tight exclusions that will say that maybe you can only have 3 primary care visits a year. Preventive services will still be covered as 100% as the law dictates, but I will not have as rich of a plan as maybe a bronze, silver, gold, or platinum. It will be designed for, okay, I see a doctor once a year, and I just want to make sure I don't lose my house or my finances, and I can buy this catastrophic plan to protect me. We had talked about Medicaid and the decision tree process that is in this system designed to expand Medicaid. The estimate is that we're going to have approximately 11 million more new people on the Medicaid rolls. You probably notice around wherever you live or wherever your business is or where you work, you probably notice all these medical aid units or MedExpresses or all these different things all of a sudden popping up all over the place. Mm-hmm. The reason behind that is because when we have talked to them, we've had conversation with those owners, is there's going to be millions of more Americans who are now going to be in the medical system. And the average physician's office, I don't know about you, but last time I went to my physician's office, I had a 2 o'clock appointment. By the time I saw him, it was like 2:30.
Right.
They're busy. What are we going to do with another somewhere between 15 and 45 million new participants, depending on the numbers that you believe? Even if we only add 11 million in the Medicaid rolls, where are those individuals going to go? All these urgent care MedExpress units are popping up all over the place to help absorb that new population. So it will be interesting on what takes place and how that happens, and the type of initial wave that's going to be placed on our medical system. Mm. So there will be a new Medicaid eligibility. It's going to be known as the Modified Adjustment Gross Income, or MAGI is what Washington calls it, and that will enhance and make the ability for individuals to be able to get into the system. It is supposed to be easier. In addition to that, in the past, it was a month-to-month type of thing. If you knew somebody who was on Medicaid, maybe they were on 1 month, kicked off another one. This new system is supposed to be more streamlined, keep people on for a longer period of time before they do the income validation to determine whether they should or should not be removed. Is to simplify both that Medicaid and the CHIP program. That the same thing is supposed to happen for the children's as well. That is now going to be a 12-month allocation period. They call it an eligibility period. In the past, that was a 6-month. So for those who had children that they need to be on CHIP, they won't have to worry as much about that if I'm going to be eligible or not and kicked off after 6 months. They'll be in for 12. All right, the enrollment assistance. We had talked about that earlier. We had talked about the different navigators, and we had talked about some of these enrollment counselors that are going to be put in place. At the end of the day, it will be whatever is done and by who you see regarding this, whether you do it yourself online, whether you do it through your smartphone or your tablet or whatever, or if you don't have that access, then you can call a toll-free number. You can talk to an insurance professional or a navigator or a counselor. Some of the states, including Pennsylvania, are putting together these buses that they're putting these laptops in, that they're going to travel around into certain parts of the communities that they feel that don't have that same technological those access points. You'll see them in the Walmarts, you'll see them in the Walgreens, the CVSs, and some other local libraries and some church-based community foundations. They're putting these people in place as well. So in the beginning, there's going to be a lot of advertising. You see the billboards. They're popping up all over the place. In the beginning, Washington had even asked the NFL, because of the timing of this in the fall, if they could advertise with the NFL. The NFL turned them down, but so they are finding other places to advertise. There are, you'll see in the next month during October, you'll see a lot of Hollywood stars talking about this in certain commercials. So there is going to be a big push in advertising, trying to get as many people into these exchanges as possible. And there will be multiple ways to do it. You can do it on paper, but somebody at the end of the day is still going to have to sit down and fill it out and do something electronically online to get you into the system. You can either, again, wait a week or less than a week now, or if you wish to also look at what some of these exchanges may look like, you can go on the healthcare.gov website. You can go online and take a look on there, and there are some examples of what some of these exchanges will look like, both on the individual side and on the shop. Please be aware that if you go onto this site, the samples that you see in the plans and also in the prices are wrong. Okay, these are just samples. The real pricing will be released next week on October 1st. There are some information out there right now. If you go on the insurance department website and also Health and Human Services and click on Pennsylvania, you can now see what some of those sample plans, bronze, silver, gold, platinum, you can see what they would look like. You can see what the deductibles are, and there's also some sample grids on what the premiums are going to be, and then also in certain tax subsidy ranges what they could be as well. We believe there's going to be some individuals that are going to be surprised because maybe they'll deem the premium to be affordable, but to get an affordable premium they might have to now go up a little bit in deductibles. And so you have to really balance that and decide at the end of the day what's going to be best for you and your family. Let's talk about the mandate that has been delayed. I have heard a lot of sighs of relief from a lot of employers who said, yes, the mandate's been delayed from January 1st, 2014 to January 1st, 2015. That's good. I don't have to worry about it to 2015. Please be careful. Please be careful of that assumption, because the exam period is always the year before. So the exam period for the 2015 payment of the employer pay tax, the exam period is done in 2014.
So it's coming.
It's coming. So right around. So I'm sure you will receive lots of phone calls here at the firm asking all your CPAs here, can you please help me calculate on what this means to me? Do I have a quality and affordable plan? If I don't offer insurance, what those tax penalties are going to be? So from a real kind of high level standpoint, let's take a couple quick snapshots of what that would mean to you and I. I'm an employer, and the first thing that the employers ask is, well, am I an employer that is a pay or pay tax employer? First thing you got to do is the definition, as we had mentioned before, is change for full-time employees. So take all your full-time employees, 30 plus hours, and add them up. You come with a number. In addition to that, CNN, if you watched the initial piece that came out about the employer mandate, they mentioned to you about the one way of figuring out the full-time equivalent. That's to take your part-timers, take their hours, divide by 120. But there's really 4 different methods. And you can run all 4 different methods, and you, the employer, can pick which is best for you. And a lot of employers aren't aware of that. So there's 4 different methods that you can run. You can pick what's best for you, especially if you're on that fringe and you want to determine if I am a pay or pay tax employer. Now, if both you add the full-time equivalents and the full-time up and you hit the magic number of 50, I am sorry, you are a pay or pay tax employer. Can't avoid that. And the reason they did the full-time equivalents is they didn't want a whole bunch of employers out there changing all their employees to 29 hours. Now, some companies may do that, and they'll change their entire workforce to that, so they don't have to worry about the offering. But as far as the mandate and the tax, you still have to use them in the calculation.
When you mentioned those 4 different methods for calculating. Where can folks find that information?
There are IRS.
Mm-hmm.
You're more than welcome to go to the IRS.gov website and spend an entire Sunday afternoon looking at all the different ways. My suggestion is they would call somebody here at the firm and ask their tax professional to, or call their insurance professional and work collectively to be able to help them determine what is the best allocation for them. Once they determine that, add the full-time, the part-time. If they hit 50, they're a pay or play. Now, what that means is you have to make a decision as an employer. Am I going to offer insurance or not? If I don't, then the first thing that I do is I get the part-timers back out, because they're only used in the calculation to see if you hit the 50, not in the calculation on the penalty. Then I get to subtract the magic number of 30. Why, we don't know. But then whoever is left on the full-time, you multiply that by $2,000 a year, and that is the penalty. The intent behind this is if you were an employer who is large, for this particular one now the government is defining large as more than 50, different than the 100, and they want you to offer insurance. Otherwise, you will contribute to the system. So you will have to contribute to the system, whereas most of these fines and penalties and revenue is going to go to the tax subsidies and the cost sharing reductions. Now, moving on to the next one, we have a lot of employers who say, okay, well, I offer insurance, Kent. No problem. I don't have to worry about anything. Well, that may or may not be the case, because the next two key questions you ask yourself is, do I offer a quality plan? We had talked about that. That's not going to be hard to meet if you offer at least a bronze level plan, one of them, you will have a quality plan. But then is it affordable? What does that mean? Well, if I work for you, if you are going to charge me more than 9.5% of my income that I work for you, originally the law said it was household income. Businesses asked Washington how are we supposed to know that. Washington has since come out and said, okay, it's not going to be household income. It's going to be of what the W-2 adjusted gross is. Whatever that number is, if you charge me more than 9.5% to contribute towards my individual premium, not employee and spouse, not children, not family, but my individual premium, if you ask me to pay 15%, let's say, then it's not affordable. So what happens? Well, if I leave your plan, go out to the exchange, buy a plan, and I get a tax subsidy, if all of those things happen, then the IRS will come back to you, my employer, and say, you owe me $3,000 for Kent. But all of those things have to happen. So even if it's not affordable to me and I don't leave your plan, and I don't go buy one from the exchange, you, the employer, are not at risk for that $3,000. So I have a lot of employers who are asking me the question, well, then I should sit down and determine what my risk exposure is. Yes, you should. Work with your advisors to make sure that you understand what your risk exposure is. Start with your lowest paid employees and back into it from there. Also, part of the law as well states that your waiting period for new hires can't be more than 90 days. So if you currently have a 180-day waiting period for a new hire, which some employers do out there, you have to change that before January 1st. What's this? How's this impact you and I? Well, come January 1st, 2014, unless this is delayed, come next tax season, there's going to be a lot of individuals who are going to be sitting down with their tax advisors, I believe, who are going to be surprised, because there's going to be a new tax form that we're going to have to fill out, show proof that we're insured, and if we're not insured and we are 18 or older, we are working and receiving income, that's full or part-time, and a U.S. citizen or have the documentation to be in the United States, if we do not have insurance, basically meaning that if we're uninsured, we are going to have to pay what is called a shared responsibility payment. We will contribute to the system. We can no longer have a free ride. The intent behind this piece of legislation is Washington believes there's a lot of the people out there called the indestructibles, the 22-year-old, the 23-year-old who'd rather buy an iPhone than buy health insurance. We're going to get them into the system because, remember, guaranteed issue, no pre-existing conditions, January 1. So we want the young and healthy in to help offset the costs of those sicker individuals who may now be getting into the system. What are those shared responsibility payments? Here's a chart of them. They're graduated. Yes, they're very low in the first couple years, but they do graduate every year after that. First year, $95 or 1%, capped out at $285. So there may be individuals who decide, you know what, it's still cheaper for me to pay a fine than it is for me to buy health insurance. But the idea behind it is that may be, but you will contribute. You no longer will be able to just get a free ride. There's some additional IRS guidance that was released this year, and it was approved. The IRS at the beginning of this year and the end of last year, when they were looking at this legislation and having to police it, went to Congress and they said we can't we cannot police it based on everything that's in here. We want you to make some changes. All these changes were proposed, and believe it or not, they were voted on and approved before Congress went on the summer recess. And I got to give the IRS credit when credit's due, because they rarely do things that are helpful to the employer. And here's some things that are. You can now exclude things like partners and sole proprietors, true independent contractors. If you're a control group, please check with the folks here at McKonly Asbury to see if you are an IRS control group. You will still be viewed under a control group as determining the employer pay or play tax. But if you have multiple businesses, and let's say one small business, maybe in outside of Pittsburgh somewhere, you got 6 employees there, but all the rest of the businesses comply. If that little 6-person business doesn't, the penalty will only now apply to that 6-person business, not the entirety. So that's some nice changes. In addition to that, when you figure out minimum essential coverage, the IRS is allowing for a 5% margin of error. I've never heard the IRS allow for any error. And then an interesting one is, in the law, anywhere where it mentions dependent, anywhere in the piece of legislation that mentions dependent, now excludes the word spouse. So spouse is no longer considered the dependent. That has changed. So some strategies as an employer. What are some employers asking us when we're out talking to them about some things I should consider? Well, in determining, first of all, is should I do an exchange, because I can guarantee you what's going to happen, if it's not already, is as an employer, you are going to get multiple calls. You probably will get 2 to 3 phone calls a week saying, hey, I have an exchange, it's the best thing in the world, you need to be doing this. Well, maybe. You really need to sit back as an employer and make decisions on what is best for you. You need to ask yourself some questions. Do you already offer a defined contribution? Maybe you already do. Or are you just doing a defined benefit, and now maybe the defined contribution type of strategies are something that you now want to consider? Currently, do you offer an enrollment platform? Maybe you do. And maybe it's a really good one and everybody likes it, and your employees get a good user experience out of it. Maybe it's even a little bit of intuitive. Well, if that's the case, then why are you going to consider an exchange then? Because the exchanges will have those properties as well, so you're really just trading one platform for another. So you need to think about it. The timing, the communications. Does your current platform allow you to get push communications out to your employees or staff? Is that important to you? Does the exchange have an integrated wellness? Some of the ones out there do. Because if you're a large employer, at the end of the day, just offering an exchange isn't necessarily going to drive down rates for the long term. Now, some of the interesting statistics and studies that are being shown out there, though, that is, if you do offer a defined contribution and you do an exchange that offers at least 3 to 5 plans, what's happening is the employee looks at that as you are now giving them choice, which they're happy about, and they are self-selecting. 2/3 of them are self-selecting down. And when they're interviewed at the end of the experience, they're saying, I had a good experience. Versus the employer coming to them and saying, I'm sorry, my premiums are going up to 12%, so I got to increase your deductible. Then the employee thinks you're taking something away from me. So the whole exchange model is different. But in the long term, if you're a large employer, your claims are your claims, and it drives your rates. So if you're not going to offer some type of wellness program or integrated wellness solution in the future, then you're going to be doing one thing and one thing only, and that's just constantly shopping insurance to try to find the best rates, because that you're going to have to do that if you're not trying to take control of your employee population and health management. So that's something that's important. And the last, not that anybody out there cares about making money, but your ROI and can it be measured? If I put an exchange in place, was it worth it? Did I get a return on my investment? Well, thank you, Suzanne. Thank you very much for your time today.
Thanks for joining us, Ken. I think it was very informative. Lots of information to process. We have some questions that have come in. One of the questions is, I have insurance that is too expensive. Do I have to drop my current plan before I register on the exchange?
That's a good question. I don't know if the question is based on whether it's individual or whether it's employer, so let's talk a minute. Let's answer that from both avenues. Let's assume for a minute that the insurance you have right now is individual and it's very expensive. Do you have to drop it before you register on the exchange? That will depend on the carrier. Use an example. Let's say right now you have an individual plan through Capital Blue Cross, and you're deeming that to be too expensive, and so you're hoping when the exchange is launched and you want to be able to switch, can you? The carrier will make that determination that if you're already in a capital plan, will you be able to change over? Most of the carriers are telling us, yes, you will be able to. But check, because across the United States there are some carriers that aren't sure yet, and so we want to make sure those rules. As an employer, it's really the same answer. As an employer, if you're going to offer a SHOP plan, then check with your carrier and find out if you're going to do it off-cycle, off-renewal. Will you allow me to move my plan into one of your exchange options, or do I have to wait for my renewal? Now, with most small employers, if you look at your contract, you have a 30-day out clause. So even if you were with carrier A and somebody came along through an exchange and offered something better through carrier B, with 30 days notice, you can get out.
Interesting.
So that is something that you would want to consider.
The other question that's come through is, how will the exchanges affect COBRA?
Good question. Very little. It does not change. The technical answer is the Patient Protection and Affordable Care Act did not change the Omnibus Act, which is the COBRA Act. So individuals from a federal standpoint will still have to be offered COBRA. Now, many states, including Pennsylvania, we had this thing called mini COBRA. That goes away January 1. Mini COBRA was designed until the exchanges were launched, because they had all these small businesses out there, and if somebody quit, I could get mini COBRA then, because I might not have been able to get a guaranteed issue, no pre-X contract. Well, now I can. So mini COBRA goes away, but the federal COBRA still stands. So federal COBRA will still be in place, will still have to be offered. The individuals still have the same rights. That doesn't change. Whether or not, though, they buy your COBRA, now those individuals are going to be shopping the individual marketplace when they get that COBRA notice in the mail. So they may not take your plan if they can find something and get a tax subsidy.
Interesting. And COBRA still applies to the 20
Correct.
employees.
The federal COBRA still applies to the 20 employees. Correct.
Okay. Another question that came through, is the employer required to offer premium contributions to dependents?
Very good question. No, they are not. In addition to that, the law effective January 1, insurance carriers are no longer allowed to tell an employer what percentage of premium to pay. In the past, carriers had certain policies or procedures that said, you know, if I'm carrier A and you want to buy a policy from me, the employer, you got to pay 50% of the single rate, okay, minimum. Otherwise, you know, you can't have a plan. That goes away January 1. What doesn't go away, however, is participation. The carriers, the Affordable Care Act allows the insurance carriers to still have participation requirements. And really the intention behind that, none of us like insurance carriers, but really the intention behind that was adverse selection. They didn't want to just say, you know, hey, you know, free for all, and you know, anybody, you know, I'm an employer and you can have my plan or not, and only have the sick people on and not the healthy, because that's kind of like buying insurance when your house is on fire. That doesn't work. So participation, each carrier can have certain guidelines, maybe 75, 80% participation rules, but they can't force you to pay a certain percentage on the single and on the dependent. Most employers today still, they might cover a certain percentage of a single but not dependent. That goes away as well. I mean, that is still the same. An employer does not have to pay for the dependents.
Okay. Thank you. Another question that came through. Will the subsidy be based on income for entire year of the year that you register?
It's a look back to, it is a look back 2-year period. And there's some more IRS checks and balances that are on top of that. That was a very, very generic answer, but it really is a 2-year look back. And they will base those tax subsidies on a 2-year income average.
We'd like to thank you once again for joining us for this presentation presented by McKonly Asbury, Certified Public Accountants. We hope you join us and participate in our upcoming events. You can stay up to date with news and learn about our upcoming events by visiting us online at www.macpas.com. Thank you again and have a great day.